Early Childhood Education from the Ladybugs, assignment number 1. 3 facts by America, Erica, and Jocelyn. Fact number 1. Myths about vaccines. According to the Center for Disease Control, the reasons many parents opt out vaccines are myths and misinformation. They state that lack of information can lead to parents to make unwise decisions about their child's health and their care. In an article about vaccine safety, the CDC stipulates that although vaccines do have some side effects, most effects are unrelated to it or a mere coincidence to the fact that children have received vaccines. Some of the main concerns that parents express are addressed as follows. 1. The fact that some vaccines contain substances such as aluminum and will go into a child's body. According to the CDC, there's a substance in the vaccines called adjuvants. An adjuvant is an ingredient added to the vaccine which helps it strengthen the immune response to the patient's body. It can be aluminum gel or aluminum salts, and it has been proved to have high efficacy when added to vaccines. Number 2. Some parents are concerned their children will develop autism if they get vaccinated. They blame a specific ingredient named thimerosal, a mercury-containing preservative, which has been used in some vaccines since the 1930s. According to the CDC, thimerosal was removed or reduced in all childhood vaccines, except for one type of influenza vaccine, although there are thimerosal-free alternative vaccines. The third big concern for parents is that their child could get the Guillain-Barré syndrome if they get vaccinated. This is a rare disorder which causes the body's immune system to attack its own nervous system, causing serious problems such as muscle weakness and paralysis. According to the CDC, the causes for GBS aren't fully known, but 2/3 of the patients who have suffered from it have been sick with diarrhea or bacterial infection several weeks before being diagnosed with the disease. As the CDC states in their articles, the main cause for parents' fear for the vaccinated for their children is misinformation. This should be a worldwide campaign supported by all governments and educational entities to address the myths and inform parents correctly so they can be assured that we all have so much more to gain from having our children and ourselves vaccinated than from not vaccinating. Fact number 2. At birth, the baby's immune system is not that strong or fully protected against harmful disease. Vaccines work with the immune system or natural defenses to fight against preventable diseases. There might be side effects of the vaccines, but they're normal vaccine side effects like fevers. Only 1 in a million is at risk of obtaining a severe or rare side effect. Vaccines are one of the best ways to prevent from getting a contagious preventable disease or even death. According to the American Academy of Pediatrics, from birth to 18 years of age for total immunization, available vaccines are 14, which are for 14 preventable diseases. From ages 1 to 12 months, they suggest hepatitis B, diphtheria, tetanus, and whooping cough, also known as DTaP, HIB, the PCV, and the rotavirus immunization, RV. At 4 months of age, polio. 6 months of age, influenza, and they should get that every flu season. 7 to 11 months of age, there's no vaccine scheduled, but it's time to catch up on anything you've missed. 12 to 23 months of age, previous vaccines plus chickenpox, measles, mumps, rubella, known commonly as the MMR, and the hepatitis A. 2 to 3 years of age, the children should have vaccines for all 14 preventable age diseases. It's also time to catch up with anything you've missed or get additional doses. You should visit your doctor once a year for checkups for your child. The flu vaccination is still needed every season. Age 4 to 6, additional vaccine doses for full protection and catch up on those missing vaccines. Visit your doctor for those checkups. 7 to 10 years of age, if the child has not received all the DTaP vaccines, or if you're not sure, a single dose of DTaP is needed to prevent tetanus, diphtheria, and pertussis. Any missing vaccines can also be caught up on, the annual flu vaccine, and your visit to your doctor for your checkup. If doctors see the child at certain medical risks, may recommend the following vaccines: hepatitis A, MCV, or PCV. Age 11 to 12, you should visit your doctor for your once-a-year checkup. At this time, vaccines that will be needed would be the DTaP, the MCV, first dose, the HPV vaccine, which comes in 3 doses, and the flu vaccine, as per every other year. Age 13 to 18, continue visiting the doctor once a year for checkups. Vaccines recommended are the MCV, a 2nd dose at 16 years of age, and your yearly flu virus. Vaccines can prevent diseases. No vaccination more risk for the child to get ill or to get serious disease. Children under 2 years of age are more vulnerable if they're not protected. There are also combination vaccines to receive only 1 shot if the concern is for multiple shots, and there's no serious side effect of it. It might sound like too many vaccines and not that much time, but multiple vaccines do not overload the immune system. The third fact we'll cover is vaccines for adults. While it's incredibly important to make certain your children are immunized in a timely manner, both for their own safety and for your own, it's also just as important to make certain we stay on top of immunizations and boosters needed as adults. According to data from the 2012 National Interview Health Survey, too few adults are getting their recommended vaccines. Every year, thousands of adults in the U.S. still suffer health problems, are hospitalized, and even die from diseases which have vaccines available. The Center for Disease Control, commonly known as the CDC, recommends that all adults need, due to the ever-changing variations and strains of the virus, a yearly flu vaccine. They also recommend the tetanus diphtheria booster every 10 years. If you did not receive the Tdap vaccine against pertussis, commonly called whooping cough, as an adolescent, you should get that once in some point in your life. In addition to that one time, women should get an additional Tdap vaccine every time they get pregnant between their 27th and 36th week. As with all medical treatment, talk with your doctor or other healthcare professional to find out which vaccines are recommended for you at your next medical appointment. Because of age, health conditions, and other factors, there are some of those that should not get vaccines or should wait up before getting them at all.